Welcome to another episode of Tubules Live. Today we're very lucky to have Dr. Allan Morgan with us. Dr. Morgan qualified from Leeds Hospital in 1995 and thereafter worked in general practice for 12 years. Following this, he completed an MSc in Endodontics at the world-renowned Eastman Dental Hospital and achieved a distinction for his MSc in 2009. Since then, Dr. Morgan continues to accept referrals for endodontic patients, but also works at the Eastman Hospital as a specialty doctor. Dr. Morgan lectures worldwide and also provides hands-on courses for GDPs. So, it gives me great pleasure to now hand over the floor to Dr. Morgan, who's going to be talking to us today about instrumentation in endodontics. Dr. Morgan.
Thanks very much, Rena, and thanks for everybody who's turned up today, and thanks for everybody who's listening out there on the Untitled Chapter's website. As Rena said, I'm going to talk tonight about chemomechanical preparation of the root canal, which is a somewhat dry and boring subject, particularly for our undergraduates here today. So, to paraphrase what I'm going to talk about, are we going to stem wind? Are we going to rotate? Are we going to reciprocate? Or are we going to swagger? So the engine objectives of tonight, we're going to talk about the principles and the history behind where we are now in terms of chemomechanical preparation. We're going to talk a little bit about strategies for preparing the root canal, and then we're going to talk a little bit about instrument design as well. We're also going to discuss how we've got to the current instrument design, and we're also going to talk about how the instruments that we're using at the minute help us prepare the root canal in the way that we can get optimum results for our patients. And finally, after the break, I'm going to try and offer some of my own thoughts on practical advice on how you might be able to prepare your root canals a little bit better and sort out problems that you will encounter whenever you do any root canal treatment. So that's the engine objectives of tonight. Root canal treatment, the evolution of root canal treatment, when I look back on the internet, showed me that in the Babylonian and Egyptian civilizations was the first sort of references you could find to toothache. They considered that toothache was a sign of divine displeasure, and they treated it by prayers of propitiation, which was delivered by priests, and empirical materia medica, which I did look up on the internet, which basically means any old drug that you could find in the cupboard, which is possibly, arguably, how root canal treatment is approached in some practices throughout London, unfortunately. The Greeks and Romans had a slightly more advanced approach to it. They actually talked about trephining root canals and trying to drain swellings. But we didn't really make a huge amount of progress. And even in the 1800s in the United Kingdom, this is from a paper that researches the history of root canal treatment, published by a chap called Lilly in what was then the Journal of the British Endodontic Society and is now the International Endodontic Journal. This was published in 1976, and he states that the primitive hand drill, sundry clumsy excavators, a range of iron cauteries with or without protective metal tubes suitable for use only in the pulp chamber, and a few thin and flexible instruments of indeterminate patterns for the treatment of the root canal, which generally would probably explain the Eastman stock cupboard on any given day, and certainly the stock cupboard in a number of practices who seem to send me referrals. Moving on from the 1800s, we started to sort of get specifically designed instruments for root canal treatment. The first rotary handpiece, I always find it quite entertaining that people who come on short courses or even come on our longer diploma courses say, well, I wasn't taught rotaries when I was an undergraduate, which would effectively make them about 153, because rotary handpieces were first mentioned in 1889. Rotaries are not new. Engine-driven instrumentation is not new. And it's quite sad that a lot of practices now, and again a lot of practitioners who come on my courses, talk about we're not given rotaries to use in our practice. It's 2013, we really should be using rotary instrumentation where possible, because it certainly facilitates root canal preparation, but we don't seem to be doing that. We seem to be stepping back, if anything else. But we're not going to the politics of that, but there it is. The other thing I find fascinating is that a lot of practices say, oh, we don't have rubber dam. It wasn't taught when I was an undergraduate. But as the short video I'm just about to show demonstrates, this is a video from 1917, New York City, and as you'll see in a second when it fires up, preoperative radiograph. We're treating the 5 and the 6. We've got rubber dam on. got no gloves. As you'll see in a minute when the patient jumps, we've got no local particularly. But what we do have is, in a second, rotary instrumentation. So this is 1917. So anybody who says we don't have, or we weren't taught rotary instrumentation, we weren't taught rubber dam, is clearly not telling the truth. As the video shows, it's quite, the preparation phase is not dissimilar to what I would do on a daily basis. And as you can see, the radiographs afterwards they're a little bit over-prepared, but it's not a bad effort, really. So rotary instruments are not new. The development of rotary instruments, this is again something from the early 20th century. We have the cursor handpiece, which was marketed by WH. This is 1928. We now have the racer handpiece, which is 1959. The interesting thing is here, you'll see that's 1928, that's 1959. In 31 years, they clearly haven't changed their advertising agency, because it's exactly the same poster, so things don't move very fast in endo in that respect. But one of the problems with all of this, and things that are driven now, is that root canal treatment and dentistry as a whole seems to be driven more by technology than the biological sciences. Root canal treatment and getting successful outcomes is very much based around getting the biology right. And if you don't get the biology right, technology is not going to help you. It's merely an adjunct. We focus far too much on technology and development. And I'm probably going to be guilty of that when I talk to you later on. We talk constantly about the new file, what's the next new system. What we don't talk about enough is the biology behind it and what we're actually trying to achieve. So I'm hopefully going to talk about that as well a little bit later on. This paper is from 1955 by a gentleman called George Stewart, and it's the first reference that I could find to the concept of chemomechanical preparation. Prior to that, it was just focused on the technological aspects. It was just, you prepared the root canal